Today's topic is BSEF examinations, which is very important for your age group, for a reproductive age, for the all the females and for the all the girls. Then we will see about the importance of a BSc and how we have to perform. Firstly, we will see about the breast importance role in the modern culture. It's a secondary characteristics considered is after the vagina, and it is a physiological functions as milk secretions to the feed infants. This is the main functions of your breast. Clinical value, it's an important experience. It's a verify that 90% of the breast cancers are found with the women themselves. If they are performing the BSc at regular basis, monthly basis, that this cancers can be, we can easily define at the early stage, we can reduce also. We can treat in the 70 to 80% of the females at the time of the primary cancerous. When the woman discovers lumps in their breast at entirely early stage, surgery can be 70 to 80% of the proven cases. In that case, if they are providing the BSc easily basis, they can easily rule out any problem with the BS, any problem in the breast changes. They help to the surgery at the 70 to 80% have proven cases, successful ratio of the surgery in the case of the breast cancer. So this is about the clinical values to rule out the early stage cancers. Now we will see about the recommendations. The recommendations for the woman about the 20 years of the age, they have to monthly provide this BSc. They have to monthly basis provide the BSc, perform the BSc. 29 to 39 age of woman, they have to clinical examinations every 3 years for the performing the examinations as a part of the physical examination. At the 40 age of older have to regularly up to 2 years they have to perform the mammography that is considered as a clinical diagnosis test for any change in the breast. Asymptomatic women of 40 and above should be have clinical examinations every year at the terms of your clinical mammography in the terms of the clinical examinations of the breast. This is a recommendations above the 40 years or asymptomatic any changes in the breast. They have to notify, they have to go for the every year examinations clinically or at the diagnosis test. Screening decisions for the older women should be individuals by the considers the potential benefits risk of the mammography in the context of the current health status and estimated expenditures. This is a for the mammography, they may quite some financial issues, they may create some radiations to the breast. So this is a decision, screening decisions on totally on the older women should be individualized by themselves. They are potentially benefits to the themselves of their risk to the themselves also. So they have to make sure about the decisions, what they have to perform, what they have to not. This is about the recommendations according to age group for the performing the BSc and the mammography. Advantages of the BSc: women can use the BSc access to their breast at the regular perform. They can perform BSc properly and regularly. They cannot the changes in their breast and seek their further evaluations for according to the regular basis. If they are providing this performing this BSc, they can easily not find any changes in their breast at the regular basis at the early stage. Examinations should be done every month in the end of the menses. All the menstruations, women at the time of the menses, the end of the last day of your menses, you have to perform this BSc. Mostly for rule out any changes because the hormonal changes can be occur in this state. So you have to perform this BSc at the time of your last day of the menses. Barrier to the BSc, mainly the major barriers BSc is the lack of the confidence and the knowledge. They are not going to provide the BSc due to their self shame and they're having the they don't have the knowledge how they have to perform. This is a major barrier to performing the BSc. The physical assessment to the BSc is in the two ways, the inspections in the second way is the palpations. Firstly, in inspections, you have to look for the symmetry, full rounds, smooth, all portions without the dumpings and the retractions or the masses. If you have to go seeing, then you have to clinically go for the examinations. According to that, slides given by observators and striae may be noted in these inspections. Nipple inverteds or areola events and the axilla even colored without the masses and braces. Axilla is also part of this inspections of the BSc. So you have to look for this criteria by performing of the inspections to the breast. In the palpations, you have to go for the family without masses, lumps, local area with marks, and the tenderness. This is a regular palpations what you have to see. The nipples should be have no discharge and axilla should be smooth and the lymph nodes are the non-palpable. This is a ratio for the palpations that you have to observe. So this is about the inspections and the palpations by performing this BSc. This criteria you have to see and this criteria you have to palpate. If any changes in this normal ratio, then you have to go for the clinical examinations. Assessment interview, firstly you have to ask for the risk history. If the client about the wrist pain tenderness is concurrent in the relation to the menstruation cycle, at time of the menstruation, some females feel the tenderness, some females feel the breast pains at the time of the menstruation, then you have to go for the breast history. Ask whether the woman's head is past currently breast lumps or the masses. If lump is present, ask for the woman's describe the locations, onset size, and the whether it is painful. This is about the questionnaires of this breast histories where they have to perform BSc regularly, which they palpate any mass, lumps, the locations, onset of the that locations, and the size of tumor and make painful by the performing. The determinants of the whether the lumps has changed shape or size considers degree of redness since it was the first notice. At the time of the perform the BSA, you have to ask the whether she have performed continuously, which has she have changed any shape, size or consistencies for the performing. So you have to go for this asking the questions of the breast history. You have to ask also for the nipple discharge for abnormal in the women for the pregnancy or lactations. Without the pregnancy or lactating women, if they feel the any nipple discharge, if there is a discharge, determine the color constituencies among the order. This is the questions asked. Then you have to go for the ask the whether woman perform BSc regularly and the like at the last day of menses or not at the every month basis. Not whether the women include axillary knots in BSc or not. Because in the time of the axillary knots, what happened? Breast don't have the masses, but in some movements, axillary knots can be found. So you have to go for the asking the question: axillary knots they have found or not? Ask for the history in their relatives, mothers, sisters, grandmothers, maternal histories, and the maternal aunts. It indicates the increased risk for the breast cancer. If she having the any physical history related to breast cancers, it may be chance to getting the breast cancer through herself also. So firstly, you have to go for the asking the questions. Any relative they have filled up the previous history of this or hereditary history of the breast cancers or not. This is about the firstly before in the ask your questions. So this is a elevation, asymmetry, bleedings, orange peel, skin colors, nipple retractions. You have to ask for the type of the performing the BSc regularly or not. This is a asking questions. Now, pre-self examination or pre-self examinations when you check for the own breast for the lumps, any changes in size and shape of breast or any other changes in the breast or underarms that you consider as a pre-self examination. This is a definition of pre-self examinations where you are going to check your own breast by yourself. You are checking the lumps, any size and shape changes. You are checking the breast asymmetrical and you are also checking the underarms same way. Receive examinations in three ways. First one is inspections before a mirror. Second step is a palpations in lying down positions. And the third step is a palpations in the standing or sitting position. In three ways, BSc can be performed. The first stage, the inspection before a mirror. You can see over here, the stand face or a mirror without the arms relaxed at your sides, arm relaxations on your hips, then turns the right and left sides view and look for the any flattenings in the sides. You can see this is some pictures of her performing the BSA in front of the mirror. She's her positions, her hands on the wrist, Then she is looking for the right and left fronts. She is looking for the any symmetrical, any asymmetrical changes in the breast or flattenings in the size of the breast. The first phase according to mirror. The second phase bends forwards from the wrist with the arms raised overheads. The second step you have to perform under the mirror also. Then you have to bend forward. You can see this is a pictures. They are going to perform the under the mirror. She is going to be bent herself further looking the movements of the wrist. So stand front with the arms raised over the hands and moves arms slowly up and downs and sides. Look for the free movements of the wrist. By bending forwards, you can see the movements of the face towards the mirrors. Any changes of symmetry, any changes of size, you can easily found in these positions. After the third positions, you have to take by raising your hands. Place your arms firmly together at the chin level and raise the elbows and wrist to the shoulder level. You can see the woman is standing, her hands are up to the lockdowns, upsides, and she is looking for the any changes in the breast. She is looking for the size and structures. In these positions, you can easily find out asymmetrical in the size of the both the wrists, any symmetrical size or any abnormality in this wrist. This is why in front of the mirror you have to performing the inspections. Now you have to go for the palpations. Palpations, first step is a lying down positions. Palpations, pillow under the right shoulders. Place your pillow and the right behind your waist. This position disturbs your breast more evenly on the chest. This is the first step. Firstly, taking the positions by help of the pillow. Under the finger weights of the middle three fingers, you have to perform the left hand to feel the halves. By helping of the another hand, you have to feel the any mass formation or any changes. Place the breast against the chest was firmly enough to know how the breast feels or reach for the formations in the lower curvature. Each breast is a normal. You have to form the normal breast. Now showing the positions. This is a pillow. You have to perform the pillow. You have to firstly, in supine positions, place a pillow under your arm and wrist. Then you have to straight your arm, then up to the head level. Then you have to perform the by the another hand. You have to perform the with the middle fingers. You have to perform the BSE in the lying down positions. Firstly, you have to go for the zigzag masses. Like you have to go for the down, then upsides and the downwards. This is a performing in the line-wise positions. Downsides, upsides and the downsides. Then you go for the inner, outer to the inner sides. This is a from the all the sides. Outer to the inner sides and then to go for the third sides is a inner to the outer sides in the circular motions. In these positions, you have to perform the one wrist, then you have to go for the another wrist. This is the another hands of the fingers, three middle fingers. Firstly, down, up and down. This is a line-wise positions. Then go for the in outer to the inner, and go for the circular motions. This is the three steps performing the one wrist. Then you have to go for the same way in another wrist also. In the lambda positions, pillow under your arms in the wrist. Then the standing positions. The third is a palpation under the standing positions. Repeat the wrist of your while the upright positions with one arms behind your head. This is the positions make easier to check upper parts of the breast and towards the armpits. This is performing the standing positions also. They can be performing the sitting positions also. It can be optional. It can be optional. Do the upright PSC in the shower. Soapy hands slides more easily over the weight. You can see the woman is standing under the shower. She is applying her hands. She is going to perform in the round motions. She is taking the small coverage. You can see down positions, second, third stroke, fourth stroke, and fifth strokes. Same way, first, two, three, four, five. Then same way, first, two, three, four. This is the why you have to perform it under the shower. You can apply the soap also. Because of applying the soap, soapy hands slides more easily over the weight. Then report any changes on the healthcare providers. If any changes you have to perform while performing, you have to find, then go for the clinical examinations. They are going for the diagnosis test also. So this is some SE. At the regular basis, all age women according to recommendations you have to perform in the three-way inspections. Second one, palpations, two-way palpations, lying down positions, and the standing positions under the shower. So this is about the BSc regular basis. If you are doing the BSc, you are performing the BSc, you can easily find any changes at the primary level of your any change related to breast. You can minimize the breast cancer also and in detections of the breast cancers at the early stage. Thank you.